presenters. Recording is in progress. If everyone but our presenters and our executive board could please turn off their cameras, I would appreciate that. Otherwise, one of our moderators will turn off your camera for you. We are honored to have two amazing speakers with us tonight, Assemblywoman Pam Lambert as well as Amy Kennedy. I want to just make a few remarks before I hand it off to my amazing team to do all of the amazing things that they do and for our speakers to talk about this deeply important issue. So I just want to, make a remark about how this is Asian American Pacific Islander Heritage Month. I want to just stand in solidarity with our Asian American Pacific Islander brothers and sisters, especially as we are seeing a consistent increase in violence and dangerous rhetoric against those communities. I also want to recognize our Jewish American Heritage Month and the increasing anti-Semitic violence that is impacting all of our Jewish friends, family, and colleagues. I also want to take a moment to recognize the recent anniversary of the murder of George Floyd and the impact that that death has had on our communities. I hope many of you join me in hoping that that horrific tragedy can hopefully continue to open people's eyes and really wake us up to the need for reforms within our communities. That being said, I am so happy to have you all here, especially since mental health impacts so many of those issues that I just touched upon. So with that being said, I'm going to hand it over to my second Vice President, Rachel Green, who will introduce us all today. Thank you, Rachel.
Oh, thank you. Thank you. Good evening, everyone. As always, it is such a pleasure to be here with you each month. I have the pleasure and honor to be the second vice president of the Federation of Democratic Women from New Jersey.
Sorry, the thunderstorm just hit and my mouth went.
Uh-oh, did it? Oh, no apologies. I'm actually watching it here as well. Hopefully we will all stay on tonight and be able to have this absolutely important and intricate dialogue here tonight. As we all know, I want to first second our president's sentiments in regards to the AAPI community, our Jewish brothers and sisters, as well as our brothers and sisters in the Black African American communities, as all of our brothers and sisters throughout this great nation. It is so important that we look out for each other, look out for our neighbors, and learn to get to know each other. With that being said, tonight's topic is so important in regards to mental health. We really believe that it is the crux of some of the key issues that we're encountering within our communities today. As the saying goes, you never know the cross someone is bearing and walking with every single day. So it's so important to have a sense of giving and get grace and just think twice before we engage, to be frankly honest with you. Stop and take time to see why maybe that person is maybe acting or engaging in the way they are, to try to listen and understand and to, give an opportunity to bridge, extend that olive branch, as they say. So with that being said, I have the pleasure of passing the mic over to the fabulous first vice president of the Gloucester County Federation of Democratic Women, the lady who organized this event tonight. And of course, I'm a proud mama over here as the president of the Gloucester County Federation of Democratic Women. She is such a rock star, so excited to have her on our team, the wonderful Kelly Reckles.
Hi, thank you, Rachel, and thank you everyone for being with us tonight on this important topic. So I'm the vice president of the Gloucester County chapter. This topic is near and dear to my heart. I am a therapist, I'm a social worker. I also am an adjunct professor at LaSalle University and will be supervising social workers who want to be clinicians. So this is really important to me, and it's really important to get more mental health clinicians licensed and in the field and ready to go with this pandemic that we have experienced. It's going to be much needed. So I really do appreciate our guests coming tonight. Senator Richard Cody was supposed to be with us tonight. He ran into an issue that he's not able to, but he has been someone who has really advocated for mental health causes, not just himself, but his wife, Mary Jo. They have the Cody Fund. It's been something that they really have focused on. So if ever you need to look into more about the Cody Fund or his work with mental health causes, do that and reach out to him as well, because he is quite the advocate for that. But we have Assemblywoman Pamela Lampett, like Alana had mentioned, who you're in the 6th legislative district, right? And I think since it's been a while, since like 2006 or so, and has worked on multiple mental health type causes. And also, I think it does correlate, but also gun violence as well. So there's a lot of overlap with some of that. And then we also have Amy Kennedy with us. She's an educator, and a longtime mental health advocate, along with her husband, Patrick. And she also was most recently the candidate for Congressional District 2 in 2020. So welcome, both of you. Thank you for being here to talk about this really important topic. It is timely in the sense that a year after the pandemic, it's good. I always like when mental health gets a bit of a spotlight. It usually gets hidden a lot of the times, and this pandemic has sort of put a little bit more of a light to it, and hopefully that kind of can create a little bit more progress, I hope, with some of the things that our country could do for it. But I want to open it up to both of you first, if you wanted to just share a little bit about your history with working with mental health and the causes that surround that. I don't know if Pam, do you want to go first, or?
Sure, happy to.
There we go. Okay.
Good evening, everybody. I am Assemblywoman Pam Lampett. I hail from the 6th District, which is encompassing many towns in Camden County and one town in Burlington County, Maple Shade. We love our Maple Shade. And I've been in the legislature since 2006. So 8 terms, and many scars and many wounds and many bills behind me. My world that I live in, my professional world, is I work at the University of Pennsylvania, and I've been there almost 40 years. So September 1st will be 40 years. And so I have lived, breathed, worked higher education and all that encompasses higher education for the entirety of my career. And, happy to say that, my first piece of legislation, which was, supported by Speaker Joe Roberts, who said to me, great advice, be an expert in what you know. And I think that's great advice for anybody with mental health sort of issues. Be an expert in what you know, because it helps to solidify who you are and make you stand out as to the qualifications that you have. So, transfer college credits seamlessly from our 2-year county colleges into our 4-year colleges, done. Took 18 months of tenacity, but done. Along the way, after chairing higher education and tackling a lot of issues, I went to the speaker and said, we don't have a bully pulpit for women and children. We've got human resources, we've got health, we've got commerce, we've got a lot of different, we don't have a location where women's issues, women and children's issues could really have a focus. And so, he trusted me, and we created the Women and Children's Committee, and a lot of really great work was done during my time as the chair, and very happy to have handed it off to very competent Assemblywoman Gabby Muscara, where we talked about issues ranging from, postpartum, which is, near and dear to Governor Cody, to, all of the issues that surround, what it takes to be a mother, what it takes to be a grandmother here in New Jersey, and to help and raise a family. So mental health is something that I have worked on for a very long time. The one piece of legislation that I'd just like to share, I never remember numbers. Let me just say, I never remember the numbers of my bills. Thank God for Ray, right? My policy director. But A 3548, and every 2 years it changes. So every year I have to remember, 4 new numbers. And I'm really good because I remember my phone number from when I was growing up. But anyway, so 3548, many years ago, I went out to Colorado on an NCSL event to learn about addiction. And during the time there, during this period of time, I realized that, the sooner we were able to capture and get to our young people, to help to support them, to give them a different direction in their life, the better off they would be, okay? The less cost it would take to actually to support them. And along the way, the American Academy of Pediatrics said that children under the age of 12 should be evaluated each and every year for their mental health. I said, great, let's put in a bill each and every year. Well, everything has roadblocks. Everything has something that you have to manage. And what we ended up having to manage on that piece of legislation is that, if you're a busy family, you're only going to your pediatrician or family practitioner once a year with your child, they weren't able to bill for a well visit and then a psychological evaluation. Crazy, absolutely crazy. I was so lucky to be able to have a really great pediatrician that brought up my children. Somehow he always sent me out of the room for a few minutes so he could look my children in the eye to say, how you doing? You sleeping? Are you drinking? You doing drugs? He would ask those sort of questions to them. Do you have friends? Do you sleep? Those sort of questions. It's the 10 questions that we all know really help to define whether or not our children are having issues. So I knew this was a roadblock, and and then with the legislature, there becomes another roadblock. And my second roadblock is that they leadership wanted me to send this bill through the Health Commission to determine whether or not, was this bill really necessary? Was it viable? Hands down, it was. Unanimous support from the commission to be able to move this piece of legislation along. And finally, it has been signed into law by Governor Murphy so that our children ages 12 and up, while they're there for a well visit or a sick visit, can be evaluated, can be reimbursed by our family practitioners so that they can catch whatever potentially is an issue or a challenge or something that needs attention for our children. So I'm very proud of that, the tenacity that it took to get it done and how many people it would really positively affect. I've got other pieces of legislation, but I could go on, and Amy's back. So let's introduce Amy.
Yes, you do have lots of legislation, which I'm very appreciative of. We're lucky to live in New Jersey for some of these pieces. But yes, hi, Amy. Thank you for being with us. Yeah, just to share a little bit. I mean, I know a lot about your advocacy work, but please share with others your long history of being involved in this conversation.
Thanks so much. Thanks for the work that you're always doing. And Pam, thank you. It sounds like you have a lot in the works that's really going to be important, especially now. I started out in just a public school classroom teaching middle school to 7th and 8th graders. And of course, at that time, what I didn't realize was that the challenging behaviors that I was seeing and, struggling with in my classroom were oftentimes symptoms of something else. And typically that would go undetected, or, students would continue to struggle for an average of 9 years until they would be diagnosed with a mental illness or with some of the other challenges that we know many people are having right now. And that led me to look for answers. I was around a lot of mental health conversations because my husband's work. Patrick had served in Congress, and in that time, not only had he talked about his own struggle with addiction, but he also was the author of the Mental Health Parity and Addiction Equity Act, which meant that insurance companies had to cover mental health same as physical health, which we know is still a challenge today. So although that is the federal law, it gets enforced by the states, and we have to make sure that the insurance companies are adhering to that. And so my exposure to that then opened my eyes to how much better we could be doing in schools to serve students and make sure that they were ready to learn. And that led me down this path to advocate for adolescent mental health and to serve on the board of Mental Health America, which has the slogan of Before Stage 4. And we know that with any other illness, we would be talking about prevention, we would be talking about early intervention. And it's taken a long time for us to begin to have those conversations of how we can do that for our own mental health. And I also serve on the board of the JED Foundation, which is focused on suicide prevention on college campuses as well as in high schools and readiness. So that transition, which especially this year can be very difficult. We have a lot of young people going off to college for the first time this year, and some of those who delayed a year in doing so. And yet there's this new anxiety. Everybody's been home and isolated, and then to make this big shift is a tough transition. And we want to know, parents want to know too, that their kids are going to be okay. And so I think it's a really important conversation to have. And I'm glad to serve as the education director for the Kennedy Forum. And I'll look forward to telling you some of the work that we're doing.
Thank you. Yeah, you bring up a good point about schools too. It used to be where, you'd have the guidance counselors at school to kind of work on these things, and they have just been inundated with other tasks and jobs where I feel like they can't do more of the counseling and support that maybe that role that they used to take on. And so it is sort of, it's not just, okay, here's a therapist here, or here's this program here, but in the schools as well, making sure that there's, a foundation there for them. Because, you do, people in school, the teachers, all the staff, like they see kids 5 days a week, right? All, various times of the day. So that is important as well. And I know there is some legislation out there currently about the kind of questionnaire evaluation sort of a thing. I think it's finalized. I don't know, maybe Pam can remind me, but I believe
it's assembly in Conway's bill, and it surveys students in reference to their mental health. And, I support it, but I have to say, in New Jersey, it requires parental, approval, which I believe skews the survey. When we were doing the anti-bullying Bill of Rights, and Assemblywoman Huddle was leading the charge on it, I really wanted the Swedish-based program, the OWE program, which really just springs it upon the students. Who have you been bullied by? How have you been bullied? When, where? Because when we're trying to really focus in on who do we need to deliver services to, it's not as much as the grand population as it is really a few students within our school systems that are troubled, that are causing a lot of angst and a lot of issues amongst the student population. And that could only be found during an anonymous type of survey. So I support the survey to see what we do find. However, I think that there would be better ways to be able to do it. Certainly for me in my professional life, living on a college campus, working on a college campus, interacting with parents and students each and every day, understanding the challenge of being so secluded, while taking online classes and trying to figure out their way as freshmen. What a challenge this year was. And I think that these freshmen are going to look back upon it in years to come to say, this was my growth moment. This was the time that I persevered. I was able to, figure things out by myself. I was able to find my way. I accomplished these things. And we as adults, though, need to point that out to them. Senator Cody and I, have a piece of legislation that's sitting, though, on the governor's desk. It's a 1616, which requires all of our colleges to have on the back of the student ID helpline numbers. You need to give that point of contact. You need to give that handoff. You need to be able to give them that readiness to be able to find the solutions without discrimination, without and with an anonymity, to be able to do all of this. And, that piece of legislation actually does that. And, what I have found in the legislature is that there are some significant things that can help a lot of people. That if you can focus your energies on them, the impact is something that, I as a legislator may never realize the total impact, but that it's working when you get social workers and you get people within that industry who come back to you to say, that really worked, And so you need to go back. It's not enough to create legislation. What I'm saying is you have to go back to the sources to say, is it working? I think that there are many legislators who just create legislation and just say, oh, well, I did it. But the follow through is the implementation. The follow through is it effective? And so, you need to be able to continue to do that. In Cherry Hill, when they went back to school hybrid, we toured an elementary school, a middle school, and a high school. And I was really proud about the fact that Cherry Hill school system chose to use some of their funding towards providing a mental health resource, not only for students, but faculty and staff in each and every school. There was a significant contract. There was a significant commitment that they made. And when you realize how that one person could make such an impact, to know the fact that anybody who walks through that door can say whatever they need to say, feel whatever they need to feel, and to know the fact that that person there is there for them, to give them direction, feedback, support, was very significant, I believe, in this school district. So I know that you've asked, like, what would I want to happen? That's what I would want to happen. I believe it's necessary that we have the experienced people within our schools to take care of the problems. We ask too much of our nurses, way too much of our nurses, to think that they could administer, insulin shots or administer, other drugs and do eye exams and hearing exams. And oh, by the way, you're supposed to be the therapist too. It's too much. It's too much that we're asking of our school nurses. So we need to think a little bit more strategically about, what are the other necessary positions within our school systems that we need to fund and support.
I think,
Yeah, even those, go ahead, Amy.
I was going to say you wove together a couple of really important points. One, the screenings that will be important, I think, over the next several years. And nurses being kind of that point of contact. We know that in schools right now, kids get screened for hearing and vision and scoliosis. And yet one thing that they're not screened for at school is the mental health challenges that we're talking about, anxiety and depression, suicidal ideation, things that really are going to be intrusive to their learning. And this is going to be essential that we are looking at how federal dollars from the American Rescue Plan can be spent, because as you just mentioned, some schools really did great work during this pandemic to address mental health. And it's been a suggested way to spend the $130 billion that's being allocated for education, but it's not a requirement. And so through Kennedy Forum, along with CLASP, we put together a letter for the education department. We had 100 organizations sign on that asked for specific guidance from the Secretary of Education, and they are planning to issue that. We're hoping in July, that really lays out that mental health needs to be one of the priorities for that spending. And that could look like, making the school a site of origin for telemental health, because as you said, it just cannot be only the school staff who may or may not have that type of training. But how can we reach out into the community and pull some of those resources? How can we make sure that we have trauma-informed staff, that we do training that can extend beyond when that financing is available, because we know that those dollars are limited? And then where can we build those relationships that can take us into the future? How can we change kind of what we've done to focus not only on social emotional learning that is already in practice in many schools, but also have that tier 2 and tier 3 intervention for those handful of students that are going to need more support, so that they don't have to go out of district, so that they can have trauma-informed schools.
Yeah. So, Amy, 4 or 5 years ago, I worked on a piece of legislation with Senator Vitale. It was telehealth. And, I had to explain it to people back then. What was telehealth? What was telemedicine? It was this new way of providing services. And we certainly had to work on, how it could be done, who could do it, and what was the reimbursement, for something like this. And who knew back then that telehealth, telemedicine today, during this pandemic, was so critical, not only for general health, but for mental health, especially to continuity of care. It's, continuity of care, access to somebody who's going to provide you their professional services. Certainly there were tweaks that had to go along the way. Senator Vin Kopal, provided an additional sort of piece of legislation, to support the telehealth in New Jersey. But I'm very proud of that piece of legislation, because, back then we were talking about equipment and machinery that hospitals were providing to patients when they go home. And that was telehealth as well. And all they wanted to do is to be reimbursed for their investment in this equipment. But a licensed New Jersey professional could be in Florida, they could be in North Carolina, and they could legitimately be providing services to our New Jersey residents. And so telehealth really expanded greatly during the pandemic. I'll give you a little politics story about, telehealth. In the 11th hour, we negotiated the hell out of this piece of legislation. Ray Woods, my policy director, did a fantastic job. But in the 11th hour, Warby Parker hired one of the most influential lobbyists, in New Jersey, and said, I want eye exams to be done via telehealth. I'm going, no, so, I'm not a doctor, but I got a really great friend who's a, optometrist, ophthalmologist, all of those sort of things. I said to him, can this be done through telehealth? And he goes, absolutely not, Pam, absolutely not. So I stood my ground with one of the most infamous lobbyists in New Jersey. And Warby Parker did not make inroads to New Jersey. So I could not allow for telemedicine to be used in discretionary sort of ways, because then it would lack credibility.
Mhm.
So,
Yeah.
Yeah.
And not that it is going to be for everyone listening, the Assemblywoman and myself, we know that telehealth is not the solution for all things. It's
Right.
going to be a piece of this puzzle on
Yeah.
how we address the demand, how we can offer more cultural competence, how we can, right now when there's a shortage that Kelly talked about, how we can try and meet some of that demand. I've seen some cool, technology that's coming of age where there's apps using AI that can help through both voice modulation, determine somebody's mental health state, or through what they're saying can be used with young people, and then create a dashboard for a guidance counselor, as you said, who's overwhelmed, right? There's typically one for 400 or more students, and then be able to give them a gauge or a dashboard that would show who's kind of at highest need based on the AI, and they're determining, through what's being said in the text, where there's urgency there. And, there's things that are going to need to be in person. And some of it will be really through just building those relationships, right? Because, it's everything from having somebody that greets you in the morning at the door that we missed this year so much, to just someone to help check and make sure that you've packed your homework in your backpack so that you're not stressed. And all of those little things really do add up and make someone feel cared about and part
Right.
of the community. But we want to push for training for all members of the school community, that it's going to be everyone from that, really the crossing guard. I mean, that crossing guard
Yeah.
knows the kids and sees them, knows who's late, knows how they're feeling when they leave, and everyone in between, so that they have the training that they can identify when somebody's at risk, that mental health first aid training, it might be, or some of the other things that we're hearing more about. But this, I cannot overemphasize the urgency of this crisis. As we know, Colorado just declared a state of emergency for their adolescent mental health. They are the beds, they have a shortage of beds. They are overwhelmed. Their emergency rooms are overwhelmed. Eating disorders have surged. Suicidal ideation has surged. And we know that addiction has kind of ramped up during this time as well. And so we just have to treat this like the real crisis that it is, and no holds, no holding back.
It's true. It's true. I'm 16 years doing this job, and I'm always still amazed at the pieces of legislation that need to be created to actually effectuate change, like helping to support our school system in the streamlining of the handoff of support for a student to a different mental health provider.
Yeah.
We need to create a piece of legislation for this. Yes, unfortunately we do. And so it becomes a head scratcher in terms of, why would we need to do that? It seems like it's just common sense that we would be able to pick up the phone, the social worker, the nurse, the teacher, be able to pick up the phone and be able to make that phone call, to the most local, resource. And it could happen.
Mhm.
And you need a piece of legislation for that. When I was working on college focused mental health.
Mhm.
I toured every county, which was a long drive. I toured every county and went to colleges, significant colleges in every one of the counties to say, what are you doing when you have a mental health crisis on your campus? Are you capable of handling it in-house? Have you strengthened your resources in-house? Or are you calling the county to be able to support you? And I think you'd be really disappointed, because I was really horribly disappointed at the number of colleges that just ring, 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 calling the county. I've got a student in crisis, come get them. What do you mean? You're there to be their next home. You're there to be their next learning ground, to be their next resource. And now everybody that they know within their college community is gone because they've faced this challenge and they don't know how to handle it. And now you're going to hand them off to people that they don't know.
Yeah.
So we've got significant things that we still need to work on, because unfortunately that's still happening. And you would think that with the additional funding and support that our look at the funding and the support that our colleges and our K through 12 systems are getting right now, they don't have a whole lot of strings attached to it. And we as legislators, we as the people of New Jersey, need to hold these institutions accountable for the money that they're spending.
Yeah. Yep.
Truly.
Love it.
Need to be accountable.
It takes real political will. And I think you're talking too about creating the infrastructure. We're talking so much about infrastructure plans and what's needed, but we need the infrastructure in place when there is a crisis, because right now people are in the emergency room. They're calling the police. They are not set up. So then people with mental illness are more likely to end up in jail. And we don't really have the infrastructure in place to handle what's happening. And we've got to make sure that that is part of the plan. And that comes from the political will. It comes from people coming out of the shadows. There's so much stigma around mental health, but this is the moment where we can talk about it, where we can demand
Right.
that people get the treatment that they need and deserve. And just a note on the college piece. I think one of the things that for parents that are watching to remember is that when kids go to college, they're 18. And so the college doesn't have an obligation to
I
the
know.
parents. And some colleges do have a release form. If you have a child going to college this year, please make sure they sign that so that you can be notified and be part of the plan. But that is one of those things that people don't realize. I think, you do so much planning to send your kids off to school. It's such an exciting time. And we're thinking of all the possibilities, but not necessarily about that. So asking if they have a release form, and if so, encouraging your child to sign that over.
So last night I had the honor and the privilege to swear in an amazing woman who is going to be the mayor of Haddonfield, New Jersey. She's going to be the second female mayor of this unbelievable, wonderful town. And I met her because she wanted to voice her concern about her own experience many years ago for postpartum depression and PTSD that is related to postpartum depression. And quite ironically, as I'm walking, to the event, I bump into a friend, one of my son's best friends, and his wife and their little son and sister. And his wife suffered so badly postpartum depression. And I don't think we talk about it enough. I don't think we talk about what are the triggers. what's the support that's needed. I don't think we do a very good job of that at all in terms of whether or not somebody needs to be in placement, out placement, the support that a pediatrician should be giving, or whether or not it should be coming from the OBGYN. What's the evaluation before they leave the hospital? There's so much missing in the gap of all of that. We have too many women that are falling prey to postpartum depression. And if Senator Cody was here, I'm sure he'd be talking about it, but there's not enough being done. And collectively, if there's anything, that anybody is on this meeting right now feels that we could be doing better, please get a hold of us, please. We're very willing to work on it. And Amy, if you're catching the fact that I've got a little New England Boston sort of lingo going on, I grew up 20 miles west of Boston. So I grew up loving the Kennedy family.
That's great.
Yeah.
Well, we'll go up there in the summer for a little visit with everybody that I'm looking.
And then you'll come back with that little draw.
It's not that noticeable.
No. I just have to piggyback on the point about postpartum. Right now we're hearing a lot of talk that First Lady's doing a push around maternal fetal medicine, and we also are lucky to have schools that have pre-K. What's interesting to me is how some of these things that maybe don't in the front end seem to address mental health, there really is overlap there. So when we look at what might benefit maternal health, and infant, we could say nurse family partnerships would be very helpful there, but it also would be a place where we'll start to identify that postpartum depression and be able to intervene early there as well. When we look at things like universal pre-K and how that's really helpful when we look at affordable childcare and all of the issues we're seeing with women and wages, we also will see a benefit to kids and their social emotional health and their learning as we're getting them in schools earlier and they're learning some of those basics. So, a lot of the policies I think have these positive pieces that can really influence our mental health. And when we look at them and we really put forward smart legislation, we can do this right. We can be cost effective about what we're doing. And there's possibilities there, not only through the actual services we're providing, but even in the curriculum and how we look at that, about teaching kids about their brains. Just like we learned in biology class, all of our bones, we could be learning about our brains and the chemical reactions that's happening there, fight or flight. And we all could benefit from a little bit more understanding, but also from the really good policies that you're trying to put forward. So thanks for your work.
Well, it's, my back pocket. Everybody's got somebody in their back pocket. My sister herself is a developmental pediatrician. So she's in my back pocket. She's always my resource for something, related towards the support of our children. I have been working on, the special needs community. And I don't know if everybody knows, but we have been very focused about the young people who have aged out at the age of 21 this year. And for those who are 18 and up, who really missed out on their education, missed out on developing a little bit more core competencies about themselves, in the workplace, and self-care and everything else that goes along with that. And what a really important piece of legislation this was, to be able to get it done, move it during this time frame, during the budget time frame, and get it onto the governor's desk. Because when you talk about mental health, these families are struggling. They don't know what's going to happen to their child come June 30th, in reference to what are they going to be doing with them next year. And a lot of these locations that supported the next level of support for those that were aging out have closed. They didn't have the financial wherewithal to sustain. They didn't have the infrastructure of supportive staff to sustain. So the resources have been shrunken, and the need is significant. So this needed to be done. So when you look at these families, mental health is very prevalent there. The respite care that these families needed during this pandemic, I believe is something that was neglected. And certainly, New Jersey, could and should be doing better in terms of providing, respite support for these families, because so many of them are struggling, with their ability to wake up every day.
Right, which adds more to the mental health aspect of it, right? Because then it's
Exactly.
because as you both were talking there about multiple things, I just kept thinking like, again, a lot of that just adds to the need for mental health services in all different aspects of it. But, whether it's the financial, the school, I'm even noticing now, like a lot of the insurance companies for the past year have covered co-pays. And it's funny, a couple of years ago, I was interviewed by a college student who asked me a bunch of questions about telehealth versus in person. I'm like, I would never do telehealth. Like, to me, in person, like, you got to engage. And like, I work with kids, and then there's the pandemic, and I've had to do telehealth for a while. So it's been an interesting experience, and my view of that has changed. Telehealth has been very comparable to in person, different in a way, and in person is still important. But I really never anticipated it being the way it is. But they haven't had to pay their co-pays for like the last year, and the co-pays are starting to come back in now that the pandemic is sort of hopefully on its way out, and people are starting to not keep their appointments, or they're starting to spread it out more because it's a financial hardship. And a lot of times, even though there's mental health parity, there's a lot of times you have a different benefit for mental health still. Like, you have to pay a specialist copay, and it's not the medical one. The specialist is usually higher, and you end up having a different deductible. And so, there's things that have been in place that are great, but there's still, I probably could have talked to your policy Ray for a while that time. He was excellent. But, there's so many different aspects of it where, again, it's like, so then people are starting to worry about the financial stress. So then they start to leave the mental health part, which, like luckily yesterday I had a client say, okay, I think we need to go back to every week. Like, it's a financial hardship for her to do that. But she could see that spreading it out every 2 to 3 weeks, she couldn't do it. And it's just finding that kind of balance that, how can we make it accessible, affordable, and
it all couples together with so many things. I mean, one thing leads to the other to the other. In finance, insurance, and banking, I'm the vice chair there, and I've been doing that for a while. We are talking about now creating a board to evaluate, the cost of medication in New Jersey. Well, it all sounds really good, doesn't it? I mean, really sounds really good until you get into the nitty gritty of the information going, I don't know how that's going to help the consumers, and, so many people spend a significant amount of money on medication to provide stability for themselves, their children. And, some of these drugs are new drugs, and there's not a generic form of them. And I understand the, cost of drugs and everything else, the impact it has on healthcare. But, just to create a piece of legislation that sounds good, but really is not going to be effective and do anything.
Right.
So you have to fight the good fights. You have to figure out which ones are the good fights to fight. And that's a good fight to fight because somebody's just creating another level of bureaucracy that we don't need.
Right. Yeah.
We need people to have access to the medication that they need so that they can be in the right frame of mind to be able to receive the information from the people that are going to help them so that they can be better.
Agree. I'm looking at the time and we're coming close to 8 o'clock, but I wanted to give you each a chance just to maybe if there's any last final statements on, you know, mental health, New Jersey, if you could have it how you wanted, what would it look like, sort of a thing. But any final closing statements would be great. Amy, I don't know if you want to
Yes.
start.
I think that it's important that we just realize that because kids are going back to school in September does not mean that they're going to be okay. That just going back in will not erase the time or the different stressors that they've had over this period. The anticipation is that the next 3 years, we're going to see really high rates of mental health concerns. And so we've got to take this on. This is something that existed before the pandemic. And we know that the social justice issues that have existed for a long time also play a role here. And so we need to be looking at this
Little bunny.
in all areas. But for a long time, we've talked about developing community schools and how they can really serve students. And this is, if anything would be the primary service to our young people, it would be their wellness and that they were able to enjoy and really thrive in their lives. And we cannot do this just in the current system. It's got to be a new approach. We have to employ every method possible at this moment because we really are in a crisis, and we're going to continue to see that until we treat this like the priority that it needs to be. And we're going to see when our kids are better, the whole families are better, because there is nothing more stressful, more upsetting, more than when your child is not well, when you're just worried and fearful for your kids. And we all know that. And that service that you can provide to a young person will be able to reach their family who is probably struggling. So doing all these pieces, whether it's the curriculum, the telemental health at schools, whether it's the public-private partnerships and having services there after hours, or training for all of the staff. These are all things that I'm looking forward to seeing, and I hope that New Jersey can be a real leader on this. I know that we've already made really big strides, and that, as you said, Assemblywoman, there are so many new things and policies once you get into it that you see come from there. So let's keep pushing. Thank you.
And just before we move on to you, Pam, there apparently is a question that I didn't see that we had. I don't know if Jacqueline is able to unmute herself and ask the question, or if Alana knows what the question is. And
I'm
wants
able to
share it.
unmute. Hi, hello, how are you? I thank you,
Hi, how are you?
Amy, and yourself for this much needed presentation. As a matter of fact, I reached out to Cody, Senator Cody, a while back. I'm an NJEA LAT person. Amy, I'm familiar with you, but I'm not familiar with the other young lady. However, so needed in the public schools, especially in Newark. We have the students going back early, and there's so many mental health issues as far as this virus. So I would like to have contact with you and Amy for further discussion in reference to the bill for increasing the professionals, health therapists within the schools. I
Mhm.
just retired like 3 years ago. I'm a health educator, and there's a need, and I'd like to work with you however I can to get it some additional people that can address these mental health issues.
Well, thank you. So Ray is
How
on
you doing,
the
Amy?
meeting. So just put your information into the chat box and Ray will catch it.
Okay. Pam, thank you as
Thank
well.
you.
I didn't get your name before, but I kind of got on a little late.
Thank you. Thank you so much. I can only imagine what you're seeing as kids are returning. You know, it's all of this has impacted them. You know, it's not just the stress or the worry, it's truly being hungry, you know,
Yep.
for some kids. It's having lost someone, just the worry about somebody who's unemployed in their family. I live right next to Atlantic City, and the unemployment here during this has just been so devastating, just devastating.
Yeah, the socioeconomics played a major factor before the pandemic, so you know what it's like now.
It's
All
been,
right,
it's
I don't
Kelly
know.
can connect
How
us
can I-
also.
What do I put it in the chat too? I mean, the chat is just only 5 people. I can't get it to Amy. Amy, I have your contact information. I don't have the other young lady's information. So you just want me to put it into everyone?
if you just put it into the chat box, anybody could actually see it, Jacqueline. So just go ahead and do that.
Or if you did sign up, we have your email and we can try to connect
I'll
you.
I'll put my email in there.
Great.
Okay,
So
thank you.
earlier today, I was talking to the nutritionists and dietitians. So Amy brought up a great point in terms of, you know, if we can't feed our students, they don't have the fuel to be able to activate their brains, to be able to learn, and that becomes a frustration point. Our office, my office, I'm so proud of the work that they do. You know, our biggest issue during the pandemic was unemployment. We had so many families applying for unemployment that have never applied for unemployment before. They didn't know how to do it. And so many families are hurting, and that just is a trickle down. It's the stressors that go into the families. And I'd be remiss if I didn't say a couple of things. So Mila Jay-Z, who is my vice chair on education, she's the beating of the drum about community schools, Amy, and I fully support her because, you know, if we can create an environment within the school system where it's holistic, then we really understand that we are connecting the dots, you know, towards the care that we need to provide to our students. I would also be remiss if I didn't talk about the majority leader, Assemblyman Lou Greenwald, who's my partner, who has done a yeoman's job in terms of gun control in New Jersey. We certainly know that, you know, evaluating somebody's background check, the timeliness it takes to do so, and not putting guns into the hands of people who have mental health issues, or taking guns away from domestic violence sort of situations. You know, he has been diligent on this issue. All of this just comes together, and I think you just need to find, you know, the people that are passionate about this. And I gotta say, you know, women to women, it's still a struggle in politics, and probably Amy will say this too. It's still a struggle in politics because there's only so many places for women to go. There's only so many leadership positions. There's only so much to do. And women are not as likely to be able to, you'll do this, you'll do these events, you'll talk positively about Amy and myself after this event. But, you know, unfortunately in our world, okay, what's meaningful in the legislature is crafting good legislation. What's meaningful in your district is you know your district, you know what they need. But unfortunately, you need those funds to be able to continue to elevate yourself, to be meaningful and part of the political process. It's ugly, it's horrible, I hate it, It's the worst thing in the world to do. I hated making the phone calls. I'm sure Amy did too. You know, once you get to the fundraisers and events, it's okay, but it's the worst thing in the world to do. But women are not as apt to support other women. And if I can make a call to arms, it's not just for me. I talked about Mila, Annette Keano, Shavonda Sumter. I mean, I could go on about some of the really unbelievable female legislators who are caring. And I've worked alongside Loretta Weinberg and Valerie Huddle. I mean, I
Can
could go
jump in
on.
here? Pam, just to let you know, actually, one of the action items that we're discussing during our agenda today is several of our fundraising efforts coming up to actually support everyone you mentioned.
Yeah.
And we've even revitalized our internal membership structure to ensure that the county chapters don't fundraising is actually diverted to their local candidates so that we as the state chapter can focus our efforts around our state legislature.
Good job.
Yeah.
It
We
really,
heard loud and clear.
it's the ugly side of it,
I know.
I got into this just because I wanted to help people, and look at me 16 years later. Amy didn't need to do what she did to put herself out there to expose herself and her family to this, level of scrutiny and everything else. I'm not a doctor, I'm not a lawyer, neither is Amy. Those are the people who typically go into this. And unfortunately, many times they do it because it helps to support and promote themselves. Let me just say that.
You're preaching to the choir. I hear a lot of this, but we very much support our female candidates and trying to encourage others to run. And I know I've tried to talk with like the NASW of New Jersey to really try to push to elevate social workers to run and be on state legislators. I know we have, oh my gosh, like blanking on what her name is, but we have multiple, we have a couple in New Jersey. I think there's only one in the federal social worker. So I'd like to elevate, people in the mental health field, social work as well to do that. So we have some work to do, but yeah, you guys didn't have to jump into it, and it's not fun. It's not easy. It's if we could just skip all of that part and just go in and get the work done, we'd be really good. It's
Let
all
me
the
know
other
when
stuff.
that's an option.
Yeah, me too.
You can
Me
sign
too.
Amy up
Keep each
again,
other posted. Yeah, you might even sign me up if that's the case.
Good.
But thank you both so much for joining us tonight and participating to talk about mental health. We have more work to do, but I am proud of New Jersey. I feel like New Jersey is ahead in a lot of ways. I am interested to see how this survey thing turns out. Like you said, it's kind of the follow-up of it. I'll be curious to see the results and what kind of data comes out of that, and if it seems like it's something that should continue or change. It's not like you just sign it, move on, and forget about it, but to hopefully figure out if it was, was doing what it was supposed to do. So thank you both so much. I'm going to pass it back to Alana real quick, so I think she has a little bit more. And again, thank you so much, Amy and Pam. Really appreciate it.
Thanks for having us.
Yeah, I just want to reiterate everything that Kelly just said. Thank you so much, Assemblywoman, for all of your legislative leadership on these issues. I'm a former school teacher myself, both in higher ed as well as K through 12. So I've always appreciated your advocacy. So thank you very much. And Amy, thank you for your leadership as well. I want, as we transition into the meeting business portion of tonight, I want to take a moment and recognize and thank all of the help and support of not only Kelly and Rachel, but also the rest of our executive board. Ladies, if you want to take a moment, turn your cameras on and introduce yourself, that would be great. Roberta, you're the first one on.
Hi, everyone. I'm Roberta Walters. I'm the president of Somerset County Federation of Democratic Women, and I am the corresponding secretary.
Cynthia?
Hi, I'm Cynthia Starkey. I'm the Communications Director, and thank you very much for tonight's presentations. The both of you just are amazing. And Kelly, your organization was awesome.
Rachel.
Good. Good evening, everyone. Rachel Green, Second Vice President. Thrilled and always honored to be here with everyone this evening.
And Margaret, are you on? I think Margaret might not be able to.
Oh, no, I'm sorry. I'm driving. I'm so sorry. I'm trying to, oh, here we go. I'm driving.
Be careful, Margaret. Is this
Well, it's
safe?
on cruise control, so as long as no deer jump out, I'm good. Yeah, I'm First Vice President, and thank you very much for giving me the opportunity to say hello to everyone. And that was a very exciting presentation. I respect that Pam Lampett so much. She was on our Women in Blue Day, and just the fact that she's got a hook into higher ed and education is just amazing. And what she said about Assemblyman Greenwald and the work on gun control, it's stellar work. And I'm hoping that we'll support everything they do to lessen violence in our world. Thank you, thank you. I'm looking at the road, not at the screen. So
Thank you, Margaret. I want to make sure you stay safe. We need you. And I'm not sure if Sean is with us. Sean's our treasurer. There she is. Oh, you're muted, Sean.
Okay, now
There you go.
can you hear me? Yes, hello everyone. I'm Sean Hunter. I'm the treasurer of the party. Tonight was great. I enjoyed great information. Thank you for participating and giving us all this information. And once again, thank you.
Awesome. With that, I think I've said everything I needed to in the beginning. Of course, all of our participants are welcome to continue to stay for the business portion, but we don't expect you to. Please, though. Have a great evening.
Have a safe Memorial Day.